Okay, well, let's get started. Well, thank you for joining us. Um, uh, our discussion today will be on school-based health centers and the role of community partnerships. My name is Dr. Vita Johnson, and I'm a general pediatrician and professor of pediatrics at Emory University, and also director of Partners for Equity in Child and Adolescent Health in the Department of Pediatrics. The purpose of Partners is to increase access to healthcare and to improve the delivery of healthcare for underserved children and adolescents throughout the state of Georgia. And one of our major objectives is to increase access through the expansion of school-based health centers throughout the state. And this process began in 2010 when there were only 2 school-based health centers in Georgia. Now, for those of you who are not familiar with school-based health center, let me just briefly describe them. They are basically safety net health systems that operate as doctors in the schools. So any services that you receive school-based health centers include the management of acute and chronic illnesses, preventative services, immunizations, laboratory services, behavioral health, referral to medical subspecialists, and for some of these centers, full service vision and dental care. The ultimate goal of school-based health centers is basically to address the physical, social, and emotional health needs of children so that they can achieve academically. So I've been doing this work for about 27 years. In my opinion, school-based health centers are the best model of healthcare for underserved children, primarily because they eliminate every barrier to healthcare that you could think of, such as transportation or cost or hours of operation or a parent's inability to take leave from their job to take their child to the doctor, or just a parent's inability to prioritize the healthcare needs of their children because they're dealing with so many other issues such as putting food on the table and having a roof over their heads. In addition, these centers really allow us to see children in the context of everything that impacts their lives, their homes, their communities, their schools. And as such, we can develop more effective ways of meeting their challenges because we get to see them in full context. There are about 2,600 school-based health centers nationwide. In Georgia, there were only 2 from 1994 to 2013. The Department of Pediatrics developed the first 2 school-based health centers in Georgia at Whiteford Elementary and Sammy Coyne Middle Schools. I served as the medical director and program director of those centers. It was always our intent to take school-based health centers to scale in the state. The fact that we only had 2 for 15 to 20 years really was somewhat of an indictment against the state. And so we developed Partners in 2009 in order to do just that. In order to take school-based health centers to scale, there's sort of 4 basic criteria that need to be met. The first is that you have to have community buy-in and support of these centers. You have to create a sustainable model because many of them really struggle after the initial funding period. You need to demonstrate that they are of value, that you do improve health outcomes and you do reduce the cost of healthcare for the state. And then the fourth has to do with implementation fidelity, that you come up with a model that you know that works. And so those are the 4 basic criteria, and that's what we set out to do in 2009. Our discussion today is going to be centered around community buy-in and support, which is really grounded in community collaboration and partnerships. In 2009, Partners decided to expedite this community buy-in support by awarding planning grants to communities throughout the state. During this planning process, communities were required to sort of galvanize and convene local stakeholders in child health in order to work together to first define the needs of their children, then come up with strategies to address those needs, to identify which schools would be best suited for a school-based health center, and then to sort of continue this work as a collaborative to educate the community and to increase public will around the value of school-based health centers. The participants in this process included an extensive network of school districts, federally qualified health centers, hospital systems, private practitioners, mental health agencies, local service agencies such as Families Connections, health departments, and a host of other community partners. To date, we have awarded 50 planning grants that represent 54 communities or counties statewide. And this effort has led to the development of over 50 new school-based health centers in Georgia over the past 7 years. So this afternoon, I have with me 3 of my colleagues who have been more than instrumental in the expansion of school-based health centers throughout the state. They represent 3 unique areas of the state, those in the rural communities in North Georgia, our urban communities here in Metro Atlanta, and our southern communities, which are semi-rural or small cities in Southwest Georgia. All 3 of them, every last one of them, understand the critical role of developing and cultivating partnerships in order to effectively not only plan, but implement and sustain these school-based health centers. So without further ado, it is my great pleasure to introduce my fellow panelists. I want to start first with Clifton Bush.
Hey, how are you?
Hi, Clifton.
Hi, everyone.
I'm good. We're good. So Clifton is the Chief Operating Officer for Albany Area Primary Care in Albany, Georgia. He oversees the day-to-day operations of the organization's 26 locations. 7 of their locations represent school-based health centers, and 4 of these centers have expanded services to provide comprehensive dental and vision care. Since the development of their first school-based health centers in Dougherty County 7 years ago, they have developed school-based health centers in 3 additional counties in Southwest Georgia. And Clifton is an extraordinary administrator and advocate for school-based health centers. He's a young man who's achieved much in his young years, and we're very happy to have him with us. The second is Lynn Meadows. Hi, Lynn.
Hi there. Hi there.
You can hear us. Hi. Lynn is the coordinator of student health services for Fulton County School System, one of the largest school districts in the state. She has served in this capacity for over 20 years. She also serves as the state director and state data champion for the National Association of School Nurses and the Georgia Association of School Nurses. Lynn was named the School Nurse Administrator of the Year by the Georgia Association of School Nurses. And also she was named the March of Dimes Nurse Administrator of the Year. Lynn has been instrumental in the development of, I think we're at 3 school-based health centers in Metro Atlanta. Is that not right?
2 official and working on our 3rd.
Working on their 3rd, right. So last but not least, is my dear friend, Sandy Matheson. Sandy is the development officer for primary health care centers in North Georgia. She has worked in that capacity for 8 years. The primary healthcare centers is also a federally qualified health center that serves 6 counties with 8 locations. Sandy is a nonprofit executive that specializes in economic development and growth strategy through the promotion of community collaboration and team building. That's a mouthful. She works closely with community leaders to identify and meet the needs of the most vulnerable. She's referred to as the fundraising guru and currently heads up the largest fundraiser in North Georgia, with over 700 plus attending the annual Dancing with the Stars event that supports their school-based health centers. So Sandy has participated in the development of 3 school-based health centers in North Georgia since 2013. Welcome, welcome, welcome. And thank you guys so much for agreeing to participate in this panel. So I want to begin by asking, and we're going to start with Clifton, then go to Lynn and go to Sandy. What actually motivated each of you, or your organizations, in developing school-based health centers as a system of care for the children in your community?
So for our community, it was the need that was in our community. And so we actually did needs assessments within our community to determine what was the need, is there a need? And we found that there were a lot of barriers, such as, transportation for the children to have access to healthcare. And so what we wanted to do is eliminate any of those barriers that for the children in our community to access healthcare. And so again, we conducted needs assessments. We wanted to make sure to be able to educate the students, firsthand, for them to get education, while they're in school, about health and what's the importance of healthcare. So just making sure that there is no barriers. One other quick thing is that we have a main pediatric facility, and we have other facilities with pediatrics in it. And just looking at the no-show rate or the cancellation rate of the number of kids that would cancel or no-show. And so again, within the school-based health center, that eliminates that, because the parents don't actually have to be there, as long as we have a signed consent form and have contact with the parent through phone, etc. So just trying to eliminate barriers.
Okay. Sandy?
Well, we were much like Cliff. Early on, we did some strategy and planning, and we've always seen, first of all, it's part of our mission at primary health care centers to provide affordable, quality, and access, which transportation was a barrier. But we had already been working within the school system in identifying the needs of some of the higher Title I schools, and been visiting and having conversations with the school nurses and the superintendent and the principals and the social workers. And it became very apparent early on when we were in some of these schools, and you would see children sitting in a nurse's office, and a parent not able to get off the line. And in our area in North Georgia, we have Mohawk and Shaw and several manufacturing plants that it's very difficult for parents, or economically they couldn't afford to leave and come and get their children. And so what we were seeing was a trend of children going homesick on a Thursday or a Friday and coming back sicker on a Monday. And you talk about something that really motivates you to get busy in your community and start addressing some of those issues. It's seeing those little children. So it was about the access, that it's part of our mission. And, if we had our way, we'd have a school-based clinic in all of our schools in our counties.
All right.
And so very much so, like Sandy and Clifton, we were really, really motivated by just looking at the needs of some of our communities where our schools sat, and really having, as Sandy said, a passion and just motivation and a commitment to really address the health needs of students in our schools, in our community. And for us, our very first school-based health centers that we offer, we did also a community survey. And it was interesting because we found in that survey that 77% of our parents reported barriers to healthcare for whatever reason, whether it was location, access to healthcare from that perspective, from a monetary standpoint, just a host of different barriers. And so from that motivated us to galvanize ourselves, to see what we could do as a school district with our partners to bring better and easier access of healthcare to these students, because it was manifesting itself in things like a decline in immunization rates, and kids, as Sandy said, coming back to school on Monday in our regular school clinics, seeing our school nurse saying that over the weekend I was sick or I ran a fever, but I couldn't go to a doctor's office or I couldn't be seen. And so we were seeing that as well in our school district. So we were really motivated by looking at and trying to address the needs of our students and communities.
Okay, thank you. So, school-based health centers in and of themselves is a partnership, right? You bring a medical provider and you partner with the school system in order to provide these services for children, with intent, like I said before, to not only address their physical and mental health, but also to provide this wraparound service for children in order to help them be able to stay in class and learn. School-based health centers are also instrumental in creating a sense of wholeness, wellness for the entire school, because we do care for some of the needs of teachers and school staff as well. So it requires that it is a partnership in and of itself, but it really requires a more extensive partnership and collaboration throughout the community. So for each of you, who or what entities that you choose to partner with, both first to plan for your school-based health centers, then to implement it, and then to sustain it. And were they the same group of partners throughout the whole process, or did they change, your planning maybe was a little different. Your partnership was changed a bit when you start implementing. And then when you tried to sustain it, did the partnership evolve and include more people or less people? Can you just speak about this whole concept of partnerships in order to develop, sustain, and continue your school-based health centers?
So I can go first. Our partnerships, we have a lot of partnerships. Of course, the school system, we partner with them. We also partner with our local hospital. And so our local hospital, actually partnering with them and seeing the great things that the school-based health centers have done, and myself doing a presentation to them, they actually funded the construction of 2 of our centers after a couple of years, seeing the need and the things that the center does. The local community service board, we partner with them. The school nurse program, so we partner with them. They're actually part of the hospital. We actually developed advisory groups for our school-based health centers. So in each county that we have a school-based health center, there's an advisory group that consists of different, a representative from different agencies or different individuals from the community, from churches. We have Procter & Gamble here in Albany, Georgia. We had a representative that retired from Procter & Gamble. And so a lot of people from different agencies and representatives from the community on that board. The local Boys and Girls Club. The Boys and Girls Club was actually a partner that came along recently in the last 2 years. We're in the process, was supposed to start it this summer, and have developed a pediatric summer behavioral health program through our school-based health center. And we was partnering with the Boys and Girls Club for the students that would attend that program to be able to go to the Boys and Girls Club afterwards. So partnering with them. Also different health fairs, the different care managed organizations for Medicaid, we partner with them on different things for our health fairs. Walgreens Pharmacy, we also partner with them. So a lot of agencies. Our collaborations still as of today continue to grow. They have grown over time. We still work with all the different partners that we had from the beginning, but over time, those partnerships have continued to grow as we continue to grow our school-based health centers.
Sandy?
So,
Well, we've done all the things Cliff's talked about too, but I guess my point would be that, first to say that collaborations are critical to establish early on in all of our school-based programs. With we had a planning grant at one of them, so that allowed us planning time, and in the other, early on, we were able to establish a planning group that built consensus in the community even prior to the school-based clinic being approved and coming into the schools. So our collaborations have been with many people in the community. We have a core group we work very closely with the homeless school case managers and social workers. We work very closely. I remember in our advisory group, we had someone from Edward Jones. So I think the key is establishing ownership of those in the community to help support, and they become your ambassadors and your arms in the community to support the school-based program, or as one of my friends down in Cedartown says, it's their skin in the game. So, and I'm being Southern and rural probably by saying that, but so we have a wide array of partners, and they have grown over time. And it's critical that you have those partnerships, that you have people from the business community, that you have people from the school, that you have, other nonprofits are essential. We do a large kids day in preparation for kids going back to school, that we have over 60 other nonprofits come and help get kids ready for back to school at. So all those things are just extremely important. And over time, we have had people from the community come in and tour, pre-COVID, tour the clinics, and be able to see and share. We feel like one of the important things that comes out of these collaborations is being able to share your first person stories.
Mm-hmm. Absolutely. You have any first person stories you like to share?
Oh, sure. I always have first person stories. We have Coca-Cola is one of our partners and collaborative members, and they also support us through our fundraising ventures. And one of their key VPs had danced for us with Dancing with the Stars, and he had called me recently and said, Sandy, I have, a kid in my neighborhood who's one of my children's friends, and he has terrible teeth. He came over and I found an Anbesol tube in the chair after he got up, and what can we do to help him get some dental care? And this child was, I believe, 16, 17 years old and had never been to the dentist, and was just in a lot of pain with his dental issues. And we were able to get him in and get him seen and get him a dental plan in place. And now he is pain-free and doing better in his studies.
Excellent, excellent. Lynn?
So very similar to Sandy and Clifton again. Our partnerships were a little bit different when we initially started because we too were fortunate, and thanks to Emory and Dr. Johnson, to receive a planning grant, which really was the catalyst of us starting our first planning for our first school-based health center. And with that, we had community partners from the faith group, various elective officials, businesses, et cetera, that supported just the concept of our school-based health center. And then as we got the concept down and how we really wanted our school-based health center to look in our community and in our school, our partners shifted a little bit, but those folks that initially helped us became our spokesperson in the sense of just champions. So they didn't go away, their roles just changed in terms of their partnership in supporting our school-based health center. And then once we decided on our medical provider for our school-based health centers, of course, we were able to bring on some additional partners. And as Clifton mentioned, even some of our local CMOs that supported some of our work, it was very important, specifically looking at what we thought were the needs for our community, to look at partners that could support those things, other health organizations, et cetera. And so we too established then official advisory group for our school-based health center. And of course, that included various partnerships, internal, external to our school system. We are a little bit different in our school-based health center. From the very beginning, internal partnerships were equally as important as external partnerships. We really wanted to make sure from day one we had the buy-in of folks at our school system to make sure that they also were advocating then for partners from an external standpoint. But it was important for us to very early on get our area superintendents involved, get our school social workers involved. Obviously, my department, health services, and our school nurses, we were so obviously from day one, but we wanted to make sure that others in our school districts, our grant department, our communications department, all had a role in becoming partners with us in our school-based health centers.
You guys have really illustrated, first of all, how effective you guys have been in cultivating these partnerships in order to do this work. But there are many communities throughout the state. We work with a lot of rural communities to do this work, who really do not have first the capacity or the ability, sometimes they don't even recognize the resources that are in their community because they've never worked together. What sort of strategies can you did you implement in order to be intentional about your partnerships? I know sometimes people just come along, they hear about you, they come alongside and say, I want to be a part of this. But sometimes you have to make a concerted effort to reach out and to, and to garner these partnerships in a way that can, move your work along. So can you talk about some strategies that you use in order to cultivate these relationships? Because there are a lot of communities that really don't know how to do this work. And I think this is something that this is a valuable lesson that they can learn from each and every one of you.
So one of the great strategies that we utilized was the advisory group. So through the planning stage, we developed this advisory group that had individuals from different agencies and representatives from the community, local officials, et cetera. And those individuals kind of were our individuals that kind of told us about, hey, you should go talk to this partner, you should go collaborate with this partner. So utilizing those individuals that had the expertise of different resources and the connections within the community, we utilize them a lot, because they know what we needed in order to collaborate and partner with other individuals or agencies within the community. So that was one great strategy. Another thing is just when we're attending other meetings and individuals hear us talk about school-based health centers, someone will speak up and say, hey, have you talked to this agency, or have you thought about, speaking with this agency, or they're there and they come connect with us. So that's another way that we have, and just reaching out, looking at what was on the needs assessment, or what do we see what the need is within our community. My organization, we do a needs assessment annually. The local hospital does as well. So looking at what that need is, looking to see what agency may can help us, and are those agencies currently here within our community. So again, one of the key points was that advisory group. Those different individuals on the advisory group really helped us to reach out to different partners.
Okay. Sandy?
Well, our advisory committees are critical components, and we got a lot of help from our advisory council as well. And we did probably 2 or 3 other things besides the advisory council. And I love to strategize about things. So, and for some folks that may have trouble, just getting people to the advisory council meeting, we sat down and we did a mapping exercise. So, we took the area around the Tiger Creek Elementary School, and we looked at the churches that were there. We looked at the businesses that were there, and we actually, I had a pen and was mapping it out. But the other thing that's really helpful is we also work very closely with our Chamber of Commerce, and most all Chamber of Commerce have a business listing that you can look at. And as you're working with your advisory council and your principals and things, and our schools have business partners as well that support the schools. So we actually reached out and worked with them. But, we were very fortunate even though we're a more rural area, that we had several businesses that were very much on board with supporting the health and preventative focus towards children and helping them become good health consumers, that quickly came on board and supported our work.
And so I would agree. So some of our strategies, exactly like what's already been said, but to your point, Dr. Johnson, about being intentional, we, after we conducted our needs assessment in our planning phase, we really were intentional in looking at what were the needs and where did we need some assistance with, and what did we need assistance with. And we then, again, utilizing our advisory committee and our groups and our planning team, to look at who and what might be those areas and those partners that we needed to reach out to. We also, quite honestly, and you would think that because we were in a big metro area, we just had, partners galore, and we end up having partners galore. But I think the strategy for us was just sitting down, to Sandy's point, and trying to get a handle on where we wanted to go with our school-based health center, what we needed, who we needed to be at the table, and then looking from there to go after those partners. And when I say go after those partners, what I mean by that is just soliciting their help, inviting them to our advisory meetings, inviting them to just listen to our 5-minute elevator speech, if you will, about our school-based health center and the importance that they have on not just the school and students, but the community at large. The other thing I think is a great strategy is to just simply do your homework based on your community and what you feel like you need. School-based health centers to us was obviously new. So we spent a lot of time doing our homework, going to visit other school-based health centers that had already had success, looking at their models, looking at partners that they had created, and why they had created those partnerships. Also looking to organizations like Emory, again, who had experience, looking at the ideas from the School-Based Health Alliance. So we spent a lot of time just looking at foundations of school-based health centers and what had been successful in the past at other places, and then kind of built our model and our strategies related to partnerships around that.
Thanks. Those are great strategies. You know, it's I guess fairly easy when you get started to sort of incentivize and motivate people to come along and partner with you. But over time, usually either because people lose interest or their priorities shift, or you know, or their resources or they believe are best utilized elsewhere, you kind of lose that momentum. You know, those folks that you thought would be with you and stay with you sort of fall away. Can you guys speak to what has kept your partnerships and your collaborative efforts going? Now, what is the glue that has kept everybody together and at the table, continuing to revise and improve the service delivery for children and your community as a whole, and have been able to sustain this effort around, you know, maximizing access to healthcare for these children in the context of making sure that they're able to come to school, sit in classroom, pay attention, and achieve academically? What has been the glue that has kept all of your partners at the table?
So I think our glue has been the outcomes. So I think the outcomes that the community has seen and the partners that we partner with have seen have kept us glued together. So the different success stories, there have been plenty of success stories that we have had. I think also the expansion, you know, currently our school-based health centers are now offering dental services. We offer vision services. We also offer behavioral health services. I think also, you know, just the different things now, like in Dougherty County school system, all the students have access to our school-based health centers. So the school system provides transportation, you know, for no child and not have any barrier to access to healthcare. So transportation is provided daily to those centers from each school. Also, some other school systems have heard about that and now got the buy-in from those superintendents to be able to provide that same transportation for those students. So I think the outcomes, the success stories, the expansion, the growth, you know, the different things that being creative and that we're coming up with have helped us to stick together. One other thing I would say is that in one of the counties we're in, they did not have a pretty, you know, the wellness committee or the district wellness and local wellness committee for the school system was not as they wanted it to be. And so we actually came in and one of our clinic director for the school-based health centers actually started, you know, chairing that committee along with the nutrition director. And we actually took different policy changes to the school board on what type of candy they can sell for different type of fundraisers for the athletic department, and actually got those policies changed, that they, you know, can do healthy snacks and different things like that. So I think all those different outcomes, and, you know, we got partners from the YMCA that started joining, all different partners. I think that's what have kept us together is the outcomes.
Great. Sandy?
Well, for us, outcomes are absolutely, and the success stories have been key. But I think early on from our partnerships, we knew that we would need to have open and often consistent communication with those that were coming alongside with us. And we knew that to do that, we would need to be seen as part of the school system. So, you know, we're just like going to school, we're also the school-based health clinic at the school. And we worked really hard. You know, those first 3 years, we got to work really hard. I think that was a little bit of a surprise at first. The first year was we kind of had a little bit of, if we build it, they will come mentality. But a lot of people didn't know. We wound up doing a lot of education early on about what is a school-based healthcare clinic. But continuing to have that communication every time the door of the school was open, we were there working with the parents, working with the grandparents, raising grandchildren, working alongside with the business partners that were there. And then, just if you're not seeing someone, one of your sponsors or one of your supporters or those that you collaborate with, picking up the phone and checking in with them. Right now the schools are really, in a new world trying to struggle with COVID. And, there's been several times I've just picked up the phone to those that are supporting the schools to help get things that the school is needing, or to, have a conversation with one of the superintendents about how things are going. And so that has been, I think, for us, a really critical component is that consistent communication, and also having advocates that talk about the clinic. We're very fortunate in our areas. Both of our superintendents actually use our clinic, and we say that's the ultimate. But so the strategies, the results, the success stories, and consistent communication.
Okay, Lynn?
Very similar again. I think, but for us, the glue that has really kept our school-based health centers afloat is really that intentional engagement, hands down. And relationships matter. So each and every time, and as often as we can, letting our partners know how much they are appreciated, from the advice that they give to the advocacy they employ, just letting our partners know how appreciative we are for their commitment to support us ongoing in this work is really the glue that has kept us together. Again, I've talked about our advisory group. That is so key. We meet intentionally. It's part of our memorandum of understanding is that we will have advisory groups. So it is an intentional engagement with our partners and relationships. Again, just letting those partners know how critical it is for and how important we feel that it is for them to come to the table with us, because this is a community. Although it's affecting the school, the outcomes, as Clifton and as Sandy said, the outcomes benefit everybody. And so again, one thing that has also kept us are those outcomes. Our school-based health center, and I'll just take the opportunity to give Lake Forest just some huge kudos. The academic success just in the last 5 years that the school has gained in terms of just kids from a standpoint of being able to have improved seat times and improved absentee rates, et cetera, which translates directly to improved academic success. They're now a nationally known school based on the model that they have. And so again, engaging our partnerships and making sure that our partners know it's also because of your work that we're able to have this high performing school now that initially 5 years ago was a low performing school. So just having intentional engagement and letting our partners know how critical their role and the critical role that they play in our school-based health centers has been really the glue that has kept us together. And we are intentional in having a person from the school system side to keep these partners going and to keep that engagement going no matter what.
Well, thank you guys. You said it just like I wrote it, right? I'm just kidding. If we had like 2 hours, we could just continue this conversation because there's so much I would like to go over. But I think we'd like to end this session by just having you talk about the impact of COVID and this pandemic on your work, on your partnerships, on your ability to continue the mission that you set out to do, so long ago. Can you, each of you, just sort of briefly tell me what the impact has been, how you've been able to respond, and how have you been able to lean into your partners, into your collaborative efforts in order to continue your work?
So for our organization, as you probably heard, Albany, Georgia was where 4 of our school-based health centers are located. Was a major city that was hit by COVID. So we actually, working with the school system, we actually, most the school system here closed, but we actually kept 2 of the school-based health centers open. So we kept one open for one side of town for the students, and then we kept another one open on another side of town, so they will still have access to care. That's how important this, was for the school system. So students can have access to care. The school system helped us send out information to all the parents through their telephone message portal, informing them that these centers are still open, and so your children can have access to care. We were there Monday through Friday, open. Our vision clinic was not open, but we also have vision services located at another site, other sites. So the students again were informed, parents, that they can bring their kids to those sites. Same as for dental services. We actually have fortunate enough to have patient navigators within our organization that actually contact patients to make sure that they stay into care. So our patient navigators were contacting the parents, letting them know, hey, your child still can come for their appointment. The clinics, those school-based clinics are open. Please bring them here. And actually, we have had a good success rate with parents still bringing their kids to make sure they get that consistent care. There are some that have not come. So of course, we have moved them to when school goes back open. But a lot of parents actually have brought their kids. I'll give you an example. At Turner Elementary, we normally see about 300, a little over 300 encounters a month. For the month of August, we actually saw about 260 encounters. So it actually was not far off from if school was in session. So I think just utilizing all the different resources, utilizing the school system, they help us send out reminders, etc. Again, those partnerships have helped us to keep some of those kids in care.
Great.
Well, early on in the early spring, we did have to close our school-based clinics for a couple of months because of just, the school closed and getting things in preparation for and ready. But we are finding now, and we open back up in summer, that we're being called upon more than ever. I know yesterday I had a call from one of the school nurses that the registrar at the school had high blood pressure and her husband had lost his job, so she didn't have insurance from the school system. So we worked really hard to get her in and seen immediately. So we are working through it. It's changed things a little bit. We are COVID testing. We're working really closely with the school too, as part of the schools have quarantines, and there's been a little bit of panic in some of the schools. So we've worked really hard to do education and work with the schools. But and we're right in the throes right now of going into the two school systems that we have school-based clinics, and going to each of those schools and doing flu immunizations. We're working extremely hard, like Clifton was talking about, to make sure that the children and the family members are up to date on their immunizations, their wellness, and their physicals. Early spring, we had a little bit of a downturn in that people were a little bit afraid to come in, when we first started hearing about COVID. I think all the centers probably experienced that a little bit. So we've worked really hard to educate and let people know that, we are separating our sick from our well and having wellness days only. And luckily we have some mobile units that we can use as the COVID screening for our clinics. So it's changed it, but we're still doing the same work, and in new ways, and in many ways doing more work than we've done in the past.
Excellent. Lynn, finally?
Yes, so our school district obviously closed back in March early on. And so with that, we had to close our 2 school-based health centers. But luckily, again, through partnerships and the work through our medical provider, and our medical provider is Family Health Centers of Georgia, we worked behind the scenes to transition our on-site school-based health centers to a telehealth platform. And for them to have done that in less than a month was, again, just shows you the awesomeness, if you will, of partnerships and working together, how you can get things done in a quick manner. And so we were able to transition on a remote way to telehealth, so that our families and students when they needed assistance, could get assistance, and that we would not miss a beat with our kids, for instance, who had chronic illnesses like asthma, and they wouldn't miss prescriptions and things like that. And what we did was, although our students and families could not come on site at the schools because our schools were closed, they could go through the telehealth appointment. But then our medical provider opened up their sites in the community to obviously welcome those families to those centers so that we were able to keep the care going. Now that we have transitioned our schools, some of our schools now are starting to open back, and we're starting to receive our students back. Our school-based health centers, I'm pleased to say, have now opened back up, and we're getting ready to gear back up to, again, Monday through Friday work, bring our partners back in, obviously, and continue the work that we started. So we're very, very excited about that.
Okay. Well, you know, this has been a great discussion, all too short, but you guys have just really given us some valuable information and just an incredible, wonderful perspective on school-based health centers in general, and in the critical need for collaboration and partnerships specifically. So I just thank you guys once again for agreeing to be a part of this panel. It's always a pleasure to see your faces and to have a discussion with you. And until next time, this will be the end of our panel discussion.
Thank you.
Thank you.
Thank you. Bye-bye.
Bye-bye.